If you take blood pressure medication, I have one question for you. What time did you take your pill this morning? Or was it last night? Most people have never thought twice about the answer. You take it with breakfast, or you take it before bed, simply because that's when the pharmacy label said to, or because that's just when you remember. But here's something most doctors don't have time to explain in a 15-minute visit. The timing of your blood pressure medication isn't just a scheduling detail. Research over the last 2 decades has looked closely at what happens to your blood pressure, your brain, and your heart depending on when you take that pill. And the findings are more interesting and more relevant to you than you'd expect. I'm not going to tell you to change your timing today. That decision belongs to you and your doctor. What I am going to do over the next 30 minutes is walk you through exactly what the research shows, why timing matters more after 60, and the precise questions to bring to your next appointment so you can have an informed conversation instead of a guess. Let's start with the basics. Here's something a lot of people don't realize. Your blood pressure isn't a flat, constant number throughout the day. It follows a natural rhythm called the circadian blood pressure pattern. In most healthy people, blood pressure dips by roughly 10 to 20% during sleep. Doctors call this being a dipper. Then, in the early morning hours, right around the time you wake up, blood pressure naturally surges. This is a completely normal biological event tied to cortisol release and your body preparing to become active. But here's the important part. In a significant number of older adults, some studies suggest closer to a third of people over 60 that natural dip either doesn't happen or blood pressure actually rises at night instead of falling. Doctors call this pattern non-dipping, or in more pronounced cases, reverse dipping. Why does this matter? Because non-dipping and reverse dipping patterns have been associated in multiple studies with a higher risk of heart attack, stroke, and other cardiovascular events, independent of your average daytime blood pressure reading. In other words, 2 people can have the exact same blood pressure number at the doctor's office and have very different levels of underlying risk, depending on what their blood pressure is doing while they sleep. This single fact is the foundation for why timing of medication has become such an active area of research. Let's talk about that early morning surge I mentioned. Between roughly 6 and 10 a.m., your body releases a wave of hormones, cortisol, adrenaline, and others, to help you wake up and get moving. Blood pressure rises accordingly, sometimes sharply. Multiple studies have found that heart attacks and strokes occur more frequently in this early morning window than at any other point in the 24-hour day. Researchers have called this the morning surge phenomenon, and it's one of the most consistently replicated findings in cardiovascular research. If a blood pressure medication has already worn off by the time this morning surge hits, which can happen if it was taken very early the previous day and has a short duration of action, your blood vessels may be facing that surge with less medication protection on board. This is part of why some researchers have investigated whether taking blood pressure medication at night rather than in the morning might provide better coverage during those vulnerable early morning hours, since the medication would still be active in your system when the surge occurs. Now here's where I want to be very careful and very balanced, because this is a topic where headlines have sometimes overstated the science. A well-known Spanish study published on this topic followed thousands of patients over several years and reported that those who took their blood pressure medication at bedtime had better nighttime blood pressure control and, in their reported results, fewer cardiovascular events compared to those taking medication in the morning. This study got enormous attention, and for a while, take your blood pressure pills at night became common advice repeated across the internet. However, and this is important, a separate, very large, carefully designed study published more recently, involving over 21,000 patients across the UK, found no significant difference in cardiovascular outcomes between morning and evening dosing. Patients did equally well whether they took their medication in the morning or at night. So what do you do with two major studies that seem to disagree? This is exactly the kind of nuance a good doctor helps you navigate, and here's the honest, balanced takeaway. The timing question is genuinely still being studied, and there isn't a single universal answer that applies to everyone. What seems to matter more than morning versus night in general is your individual blood pressure pattern, whether you're a dipper, a non-dipper, or a reverse dipper, which can only be determined through a specific kind of monitoring. This brings us to something I think is far more valuable than any general timing rule, a test called ambulatory blood pressure monitoring, or ABPM. This involves wearing a small automatic blood pressure cuff for a full 24-hour period, typically including while you sleep. It takes readings every 20 to 30 minutes around the clock. At the end of the day, your doctor gets a complete picture: your daytime average, your nighttime average, whether you dip normally, and exactly when your blood pressure tends to be highest. This is genuinely one of the most useful tests that most people over 60 have never heard of, let alone had done. Instead of guessing whether you should take your pill in the morning or at night based on a general study, this test tells your doctor what's actually happening in your body. If you've been on blood pressure medication for years and have never had this kind of 24-hour monitoring done, that's a very reasonable thing to ask about at your next appointment. It's non-invasive, it doesn't require any needles, and for many people, it's covered by insurance when there's a documented reason to check, such as poorly controlled blood pressure or unexplained dizziness. While the research on morning versus night is still evolving, there are specific signs and symptoms that are worth paying attention to, regardless of what time you take your medication. The first is dizziness or lightheadedness upon standing, especially first thing in the morning. This can be a sign that your blood pressure is dropping lower than your body prefers at a particular time of day, a condition called orthostatic hypotension, which becomes more common with age regardless of medication. The second is unusual fatigue that seems to track with when you take your pill. For example, feeling unusually drained an hour or two after your dose, which can sometimes indicate the timing relative to your daily activity level isn't ideal for you personally. The third is headaches or flushing that occur at a consistent time of day, which can sometimes correlate with peak medication levels in your bloodstream. And the fourth is simply inconsistent home blood pressure readings. For example, if you check your blood pressure at home and notice it's well controlled during the day, but you have no idea what it's doing at night, that's a gap worth closing with your doctor. Ideally through home monitoring or the 24-hour test we just discussed. None of these signs mean you're in danger. They're simply data points, the kind of specific, concrete detail that turns a vague, "I don't feel quite right," into a productive conversation with your doctor. Let's talk about something every person on blood pressure medication should be doing: home monitoring with a simple, validated upper arm blood pressure cuff. Here's why this matters so much. A single blood pressure reading at a doctor's office is a snapshot, and for many people, that snapshot is skewed higher than normal simply because of the stress of being at a medical appointment, a well-documented effect called white coat hypertension. On the flip side, some people have the opposite problem: normal readings at the doctor's office, but elevated blood pressure in daily life, called masked hypertension. And this pattern has been linked to some of the same risks as consistently high blood pressure. Home monitoring, done properly, gives you and your doctor a much more accurate, real-world picture. Here's how to do it well. Sit quietly for 5 minutes before measuring. Keep your feet flat on the floor, support your arm at heart level, and take 2 readings 1 minute apart, both morning and evening, ideally before medication and before eating. Write these numbers down or use an app that logs them and bring the log to every appointment. This single habit, done consistently over a few weeks, often reveals patterns that a single office visit never could, including exactly the kind of morning surge or nighttime pattern we've been discussing. Let's bring this all together into a clear, practical plan. And I want to repeat something important. Nothing here means you should change your medication timing on your own today. Step 1. Never adjust when you take your blood pressure medication without talking to your prescribing doctor first. Some medications behave differently depending on food intake, other medications you're taking, and your individual kidney and liver function. This isn't a one-size-fits-all decision. Step 2. Start a simple home blood pressure log this week, morning and evening, for at least 2 weeks, using the technique I just described. Step 3. Bring that log to your next appointment and ask specifically, based on my numbers, would 24-hour ambulatory monitoring be worth considering to see my nighttime pattern? Step 4. If you experience dizziness upon standing, unusual fatigue tied to your dosing schedule, or inconsistent readings between morning and evening, mention these specifically by name rather than a general, "I don't feel great." Step 5. If your doctor does recommend a timing change based on your individual pattern, make that change exactly as instructed and continue home monitoring afterward to confirm it's having the intended effect. This isn't about fear, it's about turning a once-a-year, 10-minute conversation into an informed, data-backed partnership with the person managing your cardiovascular health. Before we wrap up, I want to leave you with what might be the single most evidence-backed piece of advice in this entire video, and it has nothing to do with morning versus night. The factor that shows up most consistently across the research isn't when you take your blood pressure medication, it's whether you take it at the same time, every single day, without skipping doses. Missed doses and inconsistent timing have a far larger, better documented impact on blood pressure control and cardiovascular risk than the morning versus evening debate we've spent most of this video on. So if there's one action that matters more than anything else, it's this. Pick a time, morning or evening, whichever fits your daily routine and your doctor's guidance, and stick to it every single day. Set a phone alarm. Keep your pills next to something you use daily, like your toothbrush or your coffee maker. Consistency is the single biggest lever you actually control. Here's what I want you to take away from the next 30 minutes of your day. Blood pressure management isn't just a number at your yearly checkup. It's a daily rhythm, and understanding that rhythm, through home monitoring, honest symptom tracking, and an informed conversation with your doctor, puts real control back in your hands. If this helped you understand your own medication routine a little better, share it with someone in your life who's on blood pressure medication. This is exactly the kind of video that leads to someone finally starting a home blood pressure log. And if you haven't already, subscribe, because next week I'm covering the leg circulation vitamin that's been showing up across senior health research. The one nutrient that quietly affects how your legs feel every single day after 60. Take care of that heart of yours. I'll see you in the next one.